Nu är jag på Arlanda och jag är på väg till Tyskland för att träffa Dr.Klasmeyer. Det är många av de andra lipödemdamerna i Sverige som redan har besökt honom och opererat sig hos honom och fått jättefina resultat. Så jag hoppas såklart att han ska kunna hjälpa mig också. Största utmaningen idag blir nog dock att hitta dit till kliniken för att jag kommer att resa till Düsseldorf nu och sen måste ta mig därifrån med något slags pendeltåg till Köln och efter det då så ska jag hitta till kliniken. Jag pratar inte ett ord tyska så att det här blir ju en utmaning men det ska säkert gå bra. Jag hoppas på det och jag ser verkligen fram emot att träffa Klasmeyer.
Flygresan mellan Stockholm och Köln tar ungefär 2 timmar. Och det blev ju perfekt tid för mig att gå igenom alla frågor igen. För det är ett par stycken frågor som ständigt återkommer på bloggen. Och de vill jag gärna att Klasmeyer svarar på idag.
From the bottom of it, it's a liposuction, but you have to keep some things in mind. With a lipödem, it's very of great importance not to harm the lymphatic system. So there are generally 2 surgery methods in liposuction who are supposed to be that gentle that you won't harm the lymphatic system. This is the TAL, where you put in a lot of liquid, then the liquid goes into the fat cells grow, and then you just suck them out with a liposuction device. And the WAL, the water-assisted liposuction, this is the technique that I perform. It's a little bit different. So it's you put like not so much liquid inside. I can show you a small. It's from my lecture, so I can show you a small video if you like.
Oh yeah.
You've got the fat cells here, and you've got the skin up here and the muscle down there, and then you go inside with the device, and then there's the water jet that rinses out the fat cells from the surrounding tissue, and then you can suck them out. And as you can see, the yellow bubbles, these are the fat cells, and they are not broken and they are not completely damaged or so. So it's very gentle to the tissue, and it was not invented for the lipödem, but it was invented so that you can take these fat cells and put them somewhere else, like in breast cancer, and you want to fill up the breast again, and you don't want to use a silicone implant, so that you avoid several complications like capsular contracture or something. So it turns out that this method is very precise and very gentle to the tissue. So a lot of lipödem surgeons use this technique. The other technique, it's much older. It's working out fine as well, and you can get good results as well with the other one. But I'm a fan of this one, obviously. I do like 250-30 liposuctions a year with this system, so I think I'm kind of experienced with this. So if you give me another device...
How many years have you been doing this?
This one for the last 9 years now, and I'm now in my own private clinic for the last 4 years. It's a very safe technique. I had like 4, if you want to say, like bigger complications during the last 4 years, which one was a thrombosis, and I had 3 smaller infections which were gone after 5 days of antibiotics. So it's a very safe technique. If you say that I had like something around 800 to 900 liposuctions the last 4 years, so it's only 4 patients who needed more specialized treatment afterwards. So this is the technique I perform. I only perform it in general anesthesia because if you want to perform it in a local anesthesia, you have to fill up the tissue again with a lot of liquid, and then you lose it as a very precise instrument. So this is why, and you can do much more regions in one operation. I always try to do it in 2 operations. Depends on how what the stadium is. If it's a stadium 3, you can cure it in 2 sessions. But mostly it's done in 2 sessions. And you can do that in a local anesthesia because it's the whole legs from the front, from the inside, from the outside. And in the second round it's the lower legs from the back sides, the upper legs from the back sides, and the arms. Yeah. So if you want to do that in a local anesthesia, it's quite impossible.
How about belly and this area?
If you look into the literature, it's quite very, it's discussed, and I must say that I'm pretty sure that I've got patients who had it on the belly and on the back. If you just go after the literature, you only have it on the legs and on the arms. But I would say it can be on the belly and on the back again. Then, if it's on the belly and on the back again as well, then you have to see if it's possible in one. Depends on how much belly and how much back you have, and then sometimes you have to do a 3rd operation, or you can put it in one of the other operations as well.
Do you do operations on stage 3 patients?
Sure.
Doesn't matter how big they are?
No, normally it depends a little bit. Normally the cut is 120 to 130 kilos.
Okay.
For general anesthesia, if the patients are quite fit, and it depends a little bit why they are 130 kilos. I had a Swedish woman with, I think it was 131, 2 something, but she was a really tough lady, and it was not like looking like 130 kilos, because she was in the whole very stable, a lot of muscles, and then it's no problem. But if you're like, I don't know, 150 centimeters and 120, 130 kilos, and you get a general anesthesia, it could be a very big problem to get keep you breathing after the during the operation. So this is, but I think that 120 kilos is one cut point, and over 130, it's then you can think about doing it in a local anesthesia, but then you need several more operations. Then I had now a German woman suffering very badly, in like 150 kilos, and couldn't hardly walk, and I now told her that I can do it, but in a local anesthesia, and then we need like 6 or 7 surgeries then. Otherwise it's just the risk of complications is just too high.
About the complications, you said you had only 4 patients, but what are the risks with the
you have to differentiate. There are always like general risks of any operations, like bleeding after the operation, infection, thrombosis, embolism, and special risks that are only occur in the liposuction, like skin irregularities, sagging skin. So you have to talk this over with the patients quite in depth. So if you've got like a 3rd degree and a very loose skin and very big fatty pads on the front parts of the legs or the inner thighs, it won't be possible to reduce the fat properly without having sagging skin afterwards. So you have to talk this over with the patients in advance, and then they can decide which way I want to go. Getting rid of the pain is on the one side, but if you're looking into the mirror every morning and just start crying because your skin looks like 70 years old, you're unhappy on the other side. So there are cases you don't have to talk these things like sagging skin over, and there are things there will be sagging skin for sure, and everything in between. So it's always a very personal decision between the doctor and the patient. So, but you have to name it, and then the patient can say, okay, I want it, I don't want it, or I want it this way, I want it that way, and there's several ways.
Does it matter how far it is between the two surgeries?
Yes, normally if you're doing 2 surgeries, it's 3 months, because the regions from the first surgery have to be soft again, so the lymphatic system is working properly again, because otherwise you have like this and then everything gets swollen. So you're gonna feel like this, or lower legs like this.
Okay. I was thinking just about why you're doing the Borsiet, because as a patient you try to figure out what's the best way for me.
Yeah, sure.
And I'm very fond of the Borsiet because I want to have the most the best way for my body.
Everybody wants.
But in Sweden now they're telling us that no, it really doesn't matter. You can do it with the old-fashioned way because it wouldn't hurt your lymph vessels anyway. What can you say about that?
It's a quite difficult question, because I think the last 20-30 years there must have been a lot of lipedema patients going to a plastic surgeon having a liposuction. Nobody knows that they had a lipedema, and it's not like they all have a lymphedema afterwards. So I think there are some things you have to keep in mind, but the differences are not that big. So if you have somebody who's experienced in doing aesthetical liposuctions, I don't think that he will do things completely wrong. But there are some things you have to keep in mind, and that are a little bit special. So it's not like a yes or no answer, I think.
How is it with the scars from the?
Yeah, it's like 2 centimeters of a white. It looks like this. I did not have a liposuction on my fingers, but I always show this scar so everybody knows what.
Okay, and it's with the knees and
several.
Okay.
So normally I do one here, one there, one for the Reiterhosen. You know what I mean?
Yeah.
One for the inner thighs and knee, and then 2 up here, 1 down there, and then from the flip side it's 2 down here, 1 here, and sometimes if needed 1 up here as well.
But there is no trouble with them.
No,
they are. Take them or?
No, they're stitched with
Okay.
1 stitch, and they have to be removed after 10-12 days. So you can stitch them because there's not running out so much liquid than with the classical way with the TAL. So there you're losing a lot of liquid because they're putting so much liquid inside. So normally they are not stitched, so the liquid just can run out, which is sometimes quite annoying because just everybody knows where you came from.
Okay, I got it. Let's see. We're wondering a little bit about if you have seen any long-term complications.
No, long-term. I don't know if you do that in Sweden as well. No.
Like this or like this?
Yeah. No, long-term complications. I never had one. No. Normally, it's in the first 1 or 2 weeks you've got like bruises and pain, but then when it's getting away, the long-term results are very good and they're stable. So, but what you have to keep in mind is there's always a little bit of fat which is left inside, and even if somebody tells you, I will bring out all of the fat, you will never get rid of all of the fat, because you always need
fat.
You need the fat, and what you need the fat for is isolation on the one hand, and on the other hand you need, between the muscle and the skin, you just need one layer, so they can move against each other, because when the muscle is tensed, he will shrink, and if the skin is just stuck to the muscle, that can't happen. So nobody ever gets rid of the fat completely. That would be complete, that wouldn't be good. So, but you don't have to get rid of all of the fat to have a good long-term result. There are no long-term studies. There's one study from Germany. They were looking, or just they saw the patients again after 8 years, and there was still the same, like 1 year after the operation. Normally I see like 400 to 500 lipedema patients a year here in my clinic, and I never had one patient who came to me and said, okay, I had like a liposuction 10 years ago, and everything went back to the same stage than before the operation.
I guess you can't see the difference between the sick fat cells.
No, you can't. You're just, it's even, nobody can tell you why the liposuction is helping lipedema patients. There are no specific changes in the tissue that you can see, so that you can say, okay, this is lipedema fat, this is not lipedema fat. Not even under the microscope, it's not possible. So, yeah.
Yes. How long do you stay here at the clinic when you have the surgery?
1 day. Normally, if you're coming from Sweden, it's better to stay like 2 nights at least. It depends a little bit on the patient as well. If you're doing like 8 liters of pure fat in one session, 3 nights it's better, because sometimes you've got like blood pressure problems afterwards. So, and if you've got a long way back home, but second stage patients normally do 2 nights, and this is enough normally.
And then you can fly home, or is it better by car? Or
normally flying is better, because you don't sit so long, or you can drive home, but then it's better to put the legs straight, so because of the risk of the thrombosis.
There's no trouble with the pressure and the
No.
Cool.
You won't explode.
Good. That was
good news.
The thing I was worried about. Okay. A little bit about the results of the surgery. We have been into it a little bit, but the pain. I know we don't know why the pain is going away.
Exactly. It depends on the stage as well. If you suffer like 20 years from the lipedema and you're stage 3, it's very unlikely that you get rid of all of the pain, and that you will never need compression garments again. But you will feel much better afterwards, and you maybe need only the garments afterwards if you're doing like 6 hours by car, or it's 30 degrees outside. Yeah, so put it on in the night time for a night if you have like a very stressy day or something. So you can't do like a promise and everybody's doesn't need anything afterwards and no treatments at all. But most of the patients really the most of the time completely free of symptoms.
Okay.
I don't know why, nobody knows, but it's working. Yeah.
And are you talking about the pressure pain?
Yeah.
Or this like
everything. It's like the heaviness of the legs, the pain if you're touching the legs, and the pain because of the pressure inside. That is all getting much better.
Yeah. Do you know how it is with the back pain? Because I know a lot of us have the lower back problems.
If you do a liposuction there, and when the lipedema is a reason, then it's getting better.
Yeah.
Maybe it's a combination of back pain you have because of most of the lipedema patients, because of the very disproportional fat pads. They have a very you know what I mean? It's,
Yeah.
they don't move and yeah.
Way, no.
So it's mostly it's a kind of combination, and then you've got the compression garments. They are sometimes quite heavy in this region, so this can be a rollers can make a difference as well. So.
Yes. Can age affect the result of the operation? Yeah.
We're not getting better over the years, and our skin as well. So the older the skin is, and the less flexible the skin is, the more likely it is that you have sagging skin afterwards.
Okay. Yeah, I had some questions for you about this hormonal thing you were into, because I heard some of the ladies who were coming back from surgery told us that they have hormonal changes from the surgery. Is this possible, or how does this react to one another?
It's quite a big topic, and it's not very well understood.
No.
So it's a big question mark. But on the one hand, it's like the fat tissue produces hormone-like substances. This is why obese patients, female patients, have more breast cancer than non-obese patients.
Okay.
So there must be something hormone-like going on after the liposuction. I've got not so few patients who lose like 10 to 15 kilos after the liposuctions without doing anything. They just, after 2 liposuctions, it's just going 10 kilos down without doing anything else, or without any changes in their habits like food or sports or something. So there are these phenomena, but I don't know why, and you can promise the most patients are stable in weight afterwards, even if you do like 10, 12, 15 liters of fat away. They don't even see change when they're looking after the weight. Then you've got the other patients who take away like 6 liters of fat in 2 sessions, and then they lose 10 kilos without doing anything special. So, but
big difference then.
Yeah, big difference, and it's not like you can say, okay, this or that patient is it will come out like this or that. So you always do perform the liposuction as good as it gets, and then you have to keep fingers crossed what happens.
2 other things I was wondering about after the surgery. These harder small lipomas that you can feel, the one that hurts, are they gonna disappear? Are those the one you take out?
Yeah, normally yes.
And that's why you get rid of the pain when you push it?
It's a difference between a lipoma and the lipödem. The lipomas are one. It's its own entity. So it's a good or benign fat tumor with their own capsula around, and this is something you really can differentiate in contrast to the normal fat tissue. What you can do in the lipödema, and if you've got like a lot of small, hard, painful knots, it's more like lipomatosis dolorosa. It's this. Has got another name.
Därför?
Yeah, exactly. So this is a third entity. So this is special again.
Yeah.
But in the end, the treatment is always the same. But a small lipoma you can cut away. You just cut the skin open and pull it out, and that is what you do normally. If you've got one single or 2 or 3 lipomas, you wouldn't do a liposuction, because then the recurrence rate is a little bit higher because the capsula is still in. But in lipödema, you don't have any capsules.
The other one I was thinking about is the circulation, because we're always cold in the affected areas. Have you seen any results in that? That you don't,
seems to be better afterwards.
Yeah.
Because the fat tissue is a tissue which is not very where the blood supply is not that good, because it's a small changing or a very normal fat tissue is a very slow changing tissue. So the body needs the blood somewhere else, in the muscles, in the brain, in the abdomen with all the organs. So you don't need so much. It's not one of the priority tissues, and this is why it's so cold. And it's fat is good. It's isolating very good.
Yeah.
So the heat of the muscles is it just goes some millimeters or centimeters inside of the fat tissue. So you more get the cold. From the outside, and not the heat from the inside.
About before and after care, should
Normally
you prepare yourself?
It depends a little bit on the patient. If the tissue is quite soft, you don't wear your garments, but there's nothing special. If the tissue is quite tense, then it's good to do like LPG or MLD and using the garments before, because then it's not bleeding that much during the operation. Afterwards, it's the same. You have to wear the garments for 1 week without taking it off. Then you can start off with the MLD, and after 2 weeks you can do LPG as well.
Okay.
So it just depends on the pain. So LPG is a little bit more painful than the MLD. And
What are your thoughts about like exercise and what you eat and like stuff before and after? Should you be like stable in all your?
Normally if you're not like very much overweight, then just keep the way it is. If you can lose weight before the operation, it's always good, because it's not good to lose 10 to 12 kilos or 15 kilos after the operation. Then you will end up with a sagging skin, because you will lose much better fat on the legs after the liposuction. So I had it twice, and I had some patients who lost a lot of weight after the operation, and everything was flabby afterwards. So that's quite a downer for the patient. So if you want to lose weight, I know losing weight in lipedema is very hard, but we all have like some spare fat that we can get rid of. Exercise is always good before the operation, because the operation, it's an operation, and it will be affecting the body, and you will be it will be stressy and so on. So when you're prepared, it's better. Exercise 6 to 8 weeks after the operation is very well as well. So always what helps you feeling good is good. So
cool. What kind of compression garments you recommend after the?
I recommend the compression garments you already have, because this fits perfectly. And normally, if we have in all sizes, we have some here, but it's all like, it's not specially for the patient. It's like we can order them, and then, but because of the disproportional figure of a lipedema patient, normally they don't fit that well. And you have a big difference, because it's, I don't know how to call it in English, but the lipedema garments, they are flat woven, and the other one is round woven. So if it's round woven, you have like, I don't know, 150 stitches from here to there. So it's always the same, and it doesn't take any. It's like if you like lower legs like this and upper legs like this, it's always 150. It's always the same, and if you've like fat tissue somewhere like this, it will go inside there and then it will hurt. And this is where the thicker material and the flat woven thing is much better. Sometimes it's a little bit more comfortable with the special ones because it can be a little bit of painful to pull them down, pull them up again, but doesn't harm the outcome afterwards.
Under den långa vägen hem så satte sig tankarna lite grann från konsultationen. Och resultatet var faktiskt inte så där jättebra. För att Klasmeyer hade tidigare sagt att han skulle kunna ta bort ungefär 8 liter. Men när han såg min hud så blev han lite orolig och konstaterade helt enkelt att på de värst drabbade områdena kommer han inte kunna ta så mycket fett som man önskar på grund av att min hud är alldeles för tunn. Det här var såklart ytterligare ett bakslag i den här kampen. Men nu är jag i alla fall hemma igen efter en jättelång och intensiv och faktiskt ganska känslosam dag. Det slår mig ju återigen när jag varit iväg på en sån här resa hur sjukt det är att vi i Sverige måste åka till Tyskland för att få en konsultation kring vår operation. Min remiss här hemma i Stockholm blev ju avslagen. Jag fick inte ens komma dit och berätta om mina smärtor. Så att vi har ju liksom ingen annan råd än att vända oss utomlands. Och en del säger vänta, se vad som händer i Sverige. Jag har inte den tiden. Min kropp blir sämre för varje dag som går, känns det som. Och vi som inte har fått några barn har också den pressen. Vi vet att det för många har blivit värre efter graviditet. Och jag är inte beredd att sitta här och bara vänta på att min kropp kanske exploderar av lipödem, sjuka fettceller. Det känns inte alls som ett alternativ. Och jag känner mig trött, jag känner mig dränerad på energi. Och ja, det tär väldigt, väldigt mycket. Och ha så här ont hela tiden. Och det tar bort lite av min livsgnista som jag alltid har. Och jag visar upp den för andra ganska ofta. Och det är sällan någon får se hur jag egentligen mår. Men såna här dagar, nu när allting har landat och jag egentligen är hemma. Och så jag gick upp vid 5 i morse, nu är klockan 10. Flyger fram och tillbaka, försöker hitta överallt. Det kostar pengar. Och det tar tid. Så känner jag mig faktiskt fullständigt slut. Men nu vet jag i alla fall vad Klasmeyer sa. Och han är ju en jättetrevlig person. Och jag känner mig ändå trygg med honom. Och att som sagt att han uppmärksammade att huden kan komma att bli ett problem känns ändå mer tryggt än någon som inte har sett det. Så nu ska jag sova lite grann på det här och se, jag ska kolla lite också om det finns någonting jag kan göra åt huden innan. Eller om det är kört liksom. Och kolla upp lite grann och hur mycket kompressionen efteråt kan betyda och så. Så att även om jag känner mig lite moloken just nu så ordnar det sig säkert. Men nu sover jag på det här så får vi se vad jag kommer fram till.